Now I would like to call upon another distinguished guest, Dr. Lakshmi Narasimhan, Director Research at the Banyan and the CEO of Banyan Academy of Leadership in Mental Health. A mental health researcher, Dr. Lakshmi has been working at the intersection of poverty, homelessness, and psychosocial care for the last 20 years. At this inaugural session, I request her to share some opening thoughts on holistic well being and how the city affects that. Dr. Lakshmi. There will be a QR code which you will be able to see on your screens. You could scan it for a Tamil translation. Fair warning, we are using AI for the translation, so it may not be perfect. So, but it's there. Yeah, thank you. Dr. Lakshmi.
Thank you so much. Morning, everyone. Thank you to Urvani Foundation for bringing us together on the theme of citizens and urban governance. I think it asks us to confront something very fundamental in terms of how Indian cities work and who they actually work for, our cities. And I come to this question of cities from a very different perhaps starting point than many of you who have been working at this. For about two decades in the Banyan, I've been working. Banyan, of course, started all the way back almost 32 years ago. And our work has been with people who live at the intersection of homelessness and serious mental health conditions. And many of them are women. Many of them have cycled through abandonment, institutional neglect, structural violence. So that's the position that I arrive at this question. And drawing from this work, what I'd like to offer the audience today is what we have learned about well-being in and through this experience of working with these people. So the first thing that I'd like to talk about is when we tend to think of well-being, we look at it as a health outcome. We think of maybe even material outcomes, income, housing, etc. Something that we, measure in clinics, or perhaps we measure in surveys and we figure out whether somebody is doing well or not. But what research actually tells us is something much broader. So well-being is actually shaped by whether people have a voice, whether they have agency over their lives, whether they feel that they belong to the places which they inhabit. So do I have the agency to not just be a subject to a system, but can I shape systems? So that's very important as an aspect of well-being. So examples would be, from many of your work itself, where citizens can access reliable information about how their ward is governed, where they can participate in decisions that affect their streets, their water sources, the water bodies, their air. The city then is by definition healthier because people have agency over some of these many aspects, which are also connected to their interior lives. And the infrastructure of civic life in that sense, the information, the networks, the platforms that we used for engagement. So where, as citizens, we understand what is happening, we engage with the governance, that itself actually affects well-being. So when infrastructure, for instance, is absent, when I don't have information, when I cannot participate in my daily routines of life, the various aspects in my social environment, in my political environment that affects my life, then by itself, my well-being is eroded. And for people at the margins, the degree is much more severe. So citizenship in that sense is not just about legal status. I think for many of our service users, when they get that first, voter ID card, it's a matter of pride, not just because it is a legal status, but because they've been recognized. A homeless person has also been recognized as a citizen of this country. So of mattering in this system of governance that we have. So that's very important for us to understand from a well-being perspective. The other provocation that I want to offer the audience today is that about half of the people who come to the Banyan, homeless with a serious mental health condition, are actually from the city of Chennai itself, right? Mental health services in plenty. People have accessed care. They've accessed health care, but they've still ended up homeless. So what is this precarity that makes people homeless despite having accessed services? So on one hand, one can talk about the fact that, we have a lot of structural inequity, we have gender, caste-based discrimination, people live in extreme poverty, and all those factors delegitimize this person's existence and make them homeless. But the more important thing that we've also also uncovered through stories of the people who come in contact with us is that, how urban governance systems categorize people. A homeless person, who is a citizen, who is a beneficiary, what eligibility criteria do you need to, prove that you're poor enough to actually access social welfare. So actually in a lot of ways, or even, unfriendly places. So in a lot of ways, urban governance actually creates also the social conditions in which homelessness occurs. So many of the women that we have spoken to over the last 30 years, they talk about paying bribes to use broken public toilets. They've stopped menstruating because the stress of homelessness has been so high, choosing bus stands over open ground because then the threat of sexual violence is lower, transiting through petrol bunks. So extreme expressions of exclusion, which may seem, invisible to many, but actually this kind of unresponsive governance, inaccessible public services, inaccessible infrastructure, lack of accountability diminishes well-being not just of these people, but for all of us in this room and the wider world around. So the third provocation that I want to talk about is how we think of displacement, right? And displacement takes form in different shapes and forms. You may feel displaced within a home even when you live in a home. You may feel displaced through streets. You may feel displaced through police action. You may feel displaced within institutions because you don't receive, when you go to a public health facility, you receive very impersonal care and you don't know what your future looks like. So displacement from citizenship itself, the very idea that you're someone whose voice matters in a democratic process is so important to well-being. And the lack is not just in terms of housing, healthcare, but also identity documents, voter IDs, ration cards, land right documents. So many of our service users, even those living with families, etc., the entire administrative substrate through which the person is recognized as an existing citizen sometimes goes missing. But on the other hand, what I also want to offer is that what happens when people are even given like a very modest sort of a foothold, right? We use the phrase called hope infrastructure at the Banyan, and what we mean by this is very systematic creation of opportunities where you have everyday experiences that have some personal meaning for you. So therefore, it's not something that, a doctor or therapist just dispenses to you, but it's produced by the environments that we create for ourselves, where we are able to be very active participants. So an example of this is we moved a lot of people out of institutional facilities, people who had been staying there for 10 years, 5 years, sometimes 2 years, without going back to their families or without going into any form of independent living. We said that irrespective of where you are clinically, we'll move you out. And what we actually found is that many of them improved in terms of their hope. We actually measured hope at baseline, and then, as they started living in these homes in regular neighborhoods, and we actually found that their capacity to imagine a future for themselves was much higher than what it was earlier. And all of this varied by region. It was shaped by local support systems, by the texture of the neighborhood, whether someone had access to work, to worship, the small rhythms that we have in terms of our local lives. And we actually saw women who had spent many years on the streets and then several years within an institutional setting, labeled as a person with a mental health condition, starting to attend local government meetings as well. Talk about roads, talk about different aspects of their local governance in that sense. So therefore, what I want to sort of conclude with as some of the thoughts that I want to sort of put together is the opportunity. So I think citizenship and urban governance needs to offer the opportunity to reshape social conditions amidst which, within which our lives unfold, right? So the sessions ahead, they will explore how technology, data, processes, governance can become more transparent responses. You will hear about civic tools, ward level planning, youth participation, accountability mechanisms, and very, very essential work. But what I want to suggest is that underneath all of these systems, who gets to belong in the city? whose aspirations does the city recognize, and whose hopes does it make room for. And I think urban governance in itself can be the best form of hope infrastructure when people across board, including those at the margins, can believe that their aspirations matter and their participation counts, and the cities that they inhabit recognizes them not just as people who need to be managed, let's just manage a population, but actually active participants as knowers and doers in the lives that they wish to lead for themselves within the city. A final point, that is, what we have learned at the Banyan is a house is not a static thing, and neither is it an ultimate goal, right? So home, place, geography, it exists on a continuum. So you have a structure, you have a relationship, but very importantly, you have an imagination, you have a dream and a desire of what is one's authentic living in this space and time. And governance, therefore, if it is serve well-being, must meet people along this continuum, and the kind of civic infrastructure, participatory, mechanisms that all of you in this room contribute to is what makes it possible for people to move along this continuum. Thank you so much for this opportunity, and I look forward to the conversations ahead in the day. Thank you.